Now, we talked about also the factors that increase a person's chance of getting ear infection, and mostly for the children. Now, for the diagnosis, so some of the signs and symptoms that we talked about, fever, of course, there's that pain, the ear becoming, of course, inflamed, sensitive, and all that. So what are some of the tests done to either ascertain whether it's an acute phase or it's in the chronic phase? Or just generally to understand if it's an ear infection?
Okay, well, there are some certain instruments that are used in a hospital to examine these children.
Okay.
There's an otoscope that is normally put in the ear, and you look where at the extent of the damage in the ear.
Okay.
That is one. Number two, if the child has got discharge that is coming out, and you do a blood cell count, if the white blood cell is seriously raised and very highly raised, it means the infection is severe.
Okay.
And that kind of a thing will need for the doctor to go and examine, maybe even do a CT scan, find out what is the extent of the damage of this ear,
All right.
so that they are able to determine the kind of management they need to give to these children. Sometimes the child is going to have a discharge and can be able to hear, meaning the severity of the infection is not as bad.
Okay.
But some children, they will come with a discharge and they cannot hear completely on that side. It means the damage has completely been done. So there is what we call ear wicking. Ear wicking is the application of a wet cotton ball pad, the earbud, that is wet. You wick the ear to remove the extra discharge. And then the doctor is able to examine and see, are we getting better?
Okay.
Or you ask the mother, after we have given the medication for the last 2 days, is it improving?
Getting better.
Is the discharge, how many times have you wicked? Then they'll tell you, from the time you started the medication, I'm not seeing any difference. I'm wicking every other hour, the discharge is still coming out. Then it means we're not getting any better. It needs a further investigation so that the child is able to be treated.
Okay.
But if the wicking has reduced, so the mother was doing 5 times in a day and today she's doing once in a day, it means we are doing well.
Okay.
Yes.
All right.
Yeah.
Okay. Now, before we even get to now the kind of treatment that is offered to a child with an ear infection, can one have, let's say, the discharge without the pain? Is it possible?
Yes.
Okay.
You see, the pain comes in when the eardrum is inflamed.
Okay.
So if the eardrum bursts, it relieves the pressure. So there is no more pain. It is
Okay.
just discharge that is painless.
So at this point, they cannot hear?
They will hear.
They will hear?
Yes.
Okay.
Yes. It heals very fast.
All right.
It heals very fast. For the children, it heals very fast.
It heals fast.
It heals very fast.
Okay.
So once the eardrum has busted, it relieves the pain, the discharge comes out. Actually, it is much better because now the discharge is coming out very, very well. And then you are wicking, and on antibiotics, the course of treatment is also working very well, and they heal
Okay.
very fast.
All right.